Depression often shows up differently in different people, so it may take some time to find the right medication for you. And once you start taking it, it might cause unwanted side effects. But a new antidepressant doesn't have to be scary. Here are 5 things to remember to help you start feeling better faster. 1. Antidepressants can take a while to kick in. Antidepressants can take 4 to 6 weeks to start working in full effect, and until then, your depression symptoms may get better or worse. During this time, be sure to keep track of how you're feeling. Tell your provider if anything worries you, and appreciate your progress, even if it's slow. Above all, even if you feel like your antidepressant isn't helping, don't stop taking it before talking to your provider first. 2. Side effects happen, but they can be temporary. Side effects of antidepressants may include nausea, headaches, anxiety, sleepiness, insomnia, sexual dysfunction, and weight gain. And they're a big reason why people stop taking their antidepressants. Roughly 30% of people taking antidepressants stop within the first month, often because of one or more of these side effects. We don't know much about how often side effects happen, or if they happen more frequently with certain antidepressants, but one study gives us a clue. In about 200 patients reporting antidepressant side effects, headache was the most common, followed by nausea. Reports of agitation, sleepiness, and sexual problems were significantly fewer. The study also found that SNRI antidepressants, serotonin norepinephrine reuptake inhibitors like Cymbalta, duloxetine, and Effexor or venlafaxine caused nausea more often than SSRIs, selective serotonin reuptake inhibitors like Prozac, fluoxetine, Celexa, citalopram, Zoloft, sertraline. Additionally, Wellbutrin, bupropion, another type of antidepressant, seem to be less frequently associated with headaches and drowsiness. If you ask a pharmacist, they'll most likely say early side effects are just signs of your body getting used to the medication, so you should probably just stick it out for a few weeks. But there are also a lot of choices when it comes to antidepressants. Talk to your provider about options that minimize the side effects that bother you the most. 3. Another medication might help. If you don't see results, and you've tried several antidepressants, it's worth talking to your provider about other drugs. Other common medications used to treat depression include atypical antipsychotics, anti-anxiety medications, stimulants, anti-Parkinson medications, anti-epileptic medications. Again, never stop or change your medications without talking to your provider first. Although the above medications may be used to treat depression, in some patients, they can actually make depression symptoms worse. 4. Other methods of therapy can help. Selective serotonin reuptake inhibitors (SSRIs) are the most commonly prescribed medications for depression. However, sometimes they just don't work. Alternative therapies, such as exercise, can help here, and even when antidepressants seem to be working. Writing can also be a powerful tool. It can help you process your feelings, especially as memories during depression are often distorted, so you can better understand yourself and your experience with the medication. If taking your medicine feels like a chore, whether it be because of side effects, the dosing regimen, or the cost, it can affect whether you will take your medicine and whether it will work for you in the long run. 5. It's important to keep your provider informed. Depression is a tough disease to treat, especially because its symptoms are not easily measured. All your provider has as measurements are what you tell them about how you feel and that changes. So, be open and honest during your visits, and remember to make follow-up appointments. Your provider can only help you as much as you help them. In particular, be sure to report any withdrawal symptoms you experience when switching antidepressants. If you have been taking the old antidepressant for at least 6 weeks, there is a risk of withdrawal. Symptoms of withdrawal can include nausea, headache, dizziness, fatigue, irritability, insomnia, abdominal pain, diarrhea. Your provider will try to minimize these symptoms by weaning you off the old antidepressant, a process known as tapering, over a few weeks. There may then be a period of a few days or more before you start the new medication, so your provider can be sure the old antidepressant is completely out of your system. This waiting period helps to prevent any interactions between the two drugs. After this washout period, your